Hello, I'm Brian Tracy, and I'm here with Dr. Bill Wade, who's one of the foremost professionals in his field in the United States. And he's here to tell us a little bit about what he does and who and what he does it for and how it benefits himself, his clients, his patients, and you as well. So, Dr. Wade, tell me a little bit about your business. Tell me, what do you do for your clients and for your customers?
For our clients, we have clients and we have pets, so we're kind of unique in that way. We help provide peace of mind to the clients. We enrich their lives by helping them maintain the bond between them and their pet for as long as possible, and they keep their pet comfortable as long as possible. We try to enroll the clients and let them participate in the healthcare decisions. If their pet becomes sick or injured, we help alleviate their fears by helping their pet get on the road to recovery as quickly as possible.
Well, that's wonderful. You know, I have two dogs, or I had two dogs, and we have two cats. And so we've spent a lot of time visiting the vet, and we know how important the vet is to our lives, because when our animals have something wrong with them, it's almost like having a child that has an illness. And vets have had just a wonderfully important role in our lives. And so I thank you, and I thank your profession. Now, many veterinary practices are the same, some are different. People don't really know how they function. How do you go about giving such wonderful service to your clients and to their pets?
We have some pretty core values that the whole team has helped establish, and we try to make all our decisions based on these core values. We have a joint mission, purpose, and all the members of our staff buy into this. And one is we realize that good health is more than just the absence of disease. So our whole focus is on keeping this pet as alive and as comfortable as we can. We believe in educating our clients so they can make informed decisions. We actually make the client part of our healthcare team so they can have a part in deciding which level of care they want for their pet. There's different levels of the bond between different clients. Everybody doesn't want to or can do everything that's possible. We support them wherever they are in their stand, and we do it without judgment.
Well, that's wonderful. You know, we just lost our golden retriever recently, Brandy. She was with us for 11 years, and she developed all kinds of things over the course of her lifetime. She had cancer about 4 or 5 years ago in the paw, and our veterinarian was really helpful in treating her. Of course, she's had stomach problems, and we have a Pomeranian who's now got, I think, a bladder problem or something like that. So we've gotten pills and tablets for them. And so it's been a wonderful experience for us. Our cats seem to be doing pretty well, although they have their maladies. They're almost like children or adults, aren't they? Animals seem to have sort of a regular series of stuff.
Right. The animals they're pretty unique creatures. They have a lot more sensitivity than we give them credit for. We notice a lot of pets seem to be, if the owners have some illness or issues in the house, the pets, especially cats, are very adept at picking up on this. So a lot of times we see some like chronic illnesses, and we'll dig a little deeper and find out there's something else going on in the household. It's kind of hard sometimes where to draw the line between helping the people and helping the pets. But
right.
Our staff is really dialed into this. They're very caring and helpful, and it shows through when they're working with our clients.
Well, you mentioned values, and what we know is that companies that are based on values are far more successful and even more profitable than companies that aren't. And you also mentioned your mission that everybody buys into. Can you tell us what your mission is?
It's in several parts, but our main core is to take care of the pets. Pets can't talk, so we see ourselves as the advocate or the voice of the pet. So all of our recommendations are going to be based on what we feel that pet actually needs. We're going to communicate that to the client, and then we listen to the client and see if what we recommend resonates with what their desires are. And we actually involve the client in the treatment plan, and we might recommend ultrasound, a referral for radiation, and all this, and the client, they just don't have the means to do that, and we'll work out a plan that works best for them.
Well, it's interesting. As you're talking, I'm thinking of the book, The Horse Whisperer.
Yes.
And then today they have The Dog Whisperer. And when I was young, I read all the Dr. Dolittle stories. I don't. Did you read all those stories when you were young?
Dr.
as
Dolittle
well?
and James Harriet and
Yeah.
all of that.
Yeah, what the hell? The doctor, my friend the doctor talks to animals. Remember that from the musical? That was really good. Well, if you could just tell us a couple of really important things for pet owners to know and to think about with regard to proper veterinarian care, what would you want to pass on to our viewers?
Well, a pet ages 4 of their years for every 1 year of our years. So then what it leads down to is every 3 months your pet ages a year. So if your pet has a problem or just you want to keep your pet healthy, you need to look into it right away. We don't have the luxury of waiting that long because things that can be, we see a lot of conditions that deteriorate. If we would have caught them earlier, we could have prevented them in the beginning or treated them. So if you perceive a problem with your pet or you want to keep your pet alive as long as possible, live as happy a life as possible, pain-free life, get them in to see your veterinarian and us as soon as you think about it because, like I said, 3 months is a year.
Yeah, well, that's interesting. We've always taken our dogs and cats to the veterinarian as soon as they had a problem, the same day. If they're acting up, and the vets have always been very responsive to us. But I didn't really think about that 3 months is a year in a pet's life. Another thing that we do is, if there's nothing wrong with them, we still take them and have them get an examination once a year just to check. Do you do that sort of thing as well?
Yes, that's very important. Like I said, there are a lot of, health is more than the absence of disease. So at the annual exam, we look at a lot of different aspects. We do a nose to toes exam basically, and using that we'll come up with other recommendations. We check out their weight. We have some pretty good guidelines now to how much that pet should weigh based on their body score. We can make diet recommendations to help correct the weight. They've done some studies. I think Purita did the study. If a pet is normal weight, is going to live a year and a half longer than an overweight pet. They're going to be 10 times less likely to get arthritis as they get older. We look at their mouth. If they have dental disease, that's going to cut a year or 2 off their life. It can lead to heart problems and kidney problems down the road. Right. So we believe in preventive medicine, and that's the main focus. And if there is a problem, we can detect it early. We can make a big difference. Well,
thank you. Thank you, Dr. Wade. If you're thinking of taking care of your pet, if you really love your pet, be sure to go and see Dr. Bill Wade and have him checked out. And if there's something wrong with him or he's not feeling well for any period of time, don't delay, go today. Thank you very much, and thank you for being with us.
Thank you, Brian.